Welcome everybody to Microneedling. So I wanted to just let you know that as you know, I am a licensed esthetician and licensed instructor in the state of Georgia. I studied in South Africa. We studied nails, massage, and aesthetics together. And I, of course, have my two international licenses, Sedesco and iTech. So the reason why I'm telling you all of this is that I'm an esthetician. I'm not a medical doctor, so I am teaching you this purely from the aesthetic point of view. Also, this does not replace any traditional classes that you may go to, and you must always follow manufacturer guidelines. I also want to say that I am not certifying you to perform microneedling. This is purely for the fact that you are going to be learning, I hope, some tools and some theory so that you will be better understanding the technology, and you can also think about adding it to your practice. And if you do have it in your practice, maybe I can reaffirm or I can help you with maybe some new knowledge that you can put into your service, because when we talk scientific data with our clients, it raises the bar. Okay, so the history of microneedling. So what we can gather, it's probably been used for thousands of years. As we know, tattooing, applying things to the skin through needles have been used for thousands of years. But a German dermatologist, Ernst Kromeyer, he was kind of the father of not only microneedling, but also microdermabrasion. He took dental tools and he kind of reworked them. He had a skin clinic. And so he was working with a lot of skin diseases and disorders. And so he also used electrolysis. He came up with a patent for a micro, sort of a bunch of needles with the electrolysis. So that was the beginning. And then I would say in the 90s, Dr. Fernandez, who happens to be a plastic surgeon from South Africa, he started using microneedling for scars and wrinkling with hypodermic needles, and then he created needle stamps and needle rollers to be used. So the research on collagen induction therapy, so if you hear the word CIT roller, CIT pen, microneedling, and collagen induction therapy, those are the two of the same things. Okay, so as estheticians, we are working on the epidermis, but I think we understand now that anything we do on the epidermis is definitely going to trigger or affect the dermis, all right? So the outer layer of our epidermis is the stratum corneum, and that's the outer layer, the dead skin cells. And then under that, we have our clear translucent layer, the stratum lucidum. And then under that, the stratum granulosum, which is our granular layer. Then the stratum spinosum, which is our prickly cell layer. And then, of course, our stratum germinatum, which is the basal layer. And then that is our epidermal-dermal juncture, I like to call it. Okay, so in the dermis, we have two layers of the dermis. The papillary layer is so close to that epidermis, and all of those nerve endings are right there. So that's why when you do microdermabrasion and chemical peels, that's why the client feels a lot of discomfort a lot of times with microneedling as well. And then, of course, we have our deeper layer, our reticular layer, which we are not working on, which is below the papillary layer. All right, so when we look at needle depth, something that I like to show you is that the needle depth starts at 0.25, and that's where you're going to start. And I like to start moving the needle depth up from there. So if you can see, 0.25 is definitely for areas of the face that are thinner. And then you're going to go up to 1 millimeter. I think 1 millimeter is enough on the face. I would say that when you're dealing with scars, etc., then you want to perhaps look at going to the deeper layer. So this is a nice diagram to show you. Okay. Okay, so we're going to go ahead and have a look at the next slide. So I wanted to show you how 0.25 to 1 millimeter goes all the way down to the top dermis there for that fibroblast and elastin fiber formation. And then 1.5 to 2 millimeter if you're dealing with scars, if you can see how far down we're going there. I'm going to keep that slide up for you so that you guys can see that. Okay. From the other webinars, people said that the slides went too fast, so I'm just trying to help you out. Okay, when we're looking at collagen induction therapy and we're looking at the wrinkles and the depth of the wrinkles, sorry, slight technical difficulty today. I'm trying to figure out why you guys can't see me, and I don't seem to be figuring it out. So sorry. So if you can have a look on the left side here, we have the depth.
We can't see your the slides. You have to hit the screen sharing button again.
Okay, I'm going to do my best here.
We believe in you.
I know, it's not easy. Okay, hold on. Good?
Okay, now we can see your screen.
I don't know, can you see me?
I don't think we can see you now.
I don't know how to do that. How do I fix that?
Well, do we need to see you?
Not really, but somebody wanted to see me. I don't know, okay.
Oh, okay.
Very good, let's carry on.
I don't think you can do both. And I don't know how to do it.
No, I did it before, but you know, gosh, I did it before, but gosh, golly, I don't know how I did it. Okay, so if you can have a look on the left, the formation of those.
Oh wait, they're saying they can see you.
They can see me?
They're saying they can see both.
Awesome, yay, okay, good. All right, let's get back to action. So if you can have a look at those depths of the wrinkles on the left, all right, and then when we microneedle, we're breaking up old collagen. So I always like to say, always in my classes tell people that we're in the volume business, right? Because when we're creating collagen and elastins, we're plumping up the skin and we're smoothing the area. So then you can see we have got a nice smoother appearance with the microneedling. And what I love about microneedling, it's for any Fitzpatrick scale. So that's really wonderful about it. There's no restrictions there. So we are microneedling the area, and then we are breaking up old collagen strands and stimulating the production of collagen fibers to restore a smoother appearance. All right, so some devices available out there. Of course, there's rollers. That's kind of how it started. And then, of course, stamps. You'll see microneedling stamps. You'll see pens. And now you'll also see microneedling combined with radio frequency. So you've got that skin tightening as well. So those are sort of what I have researched out there. And of course, with LED as well. I've seen pens combined with radio frequency and LED, and I've seen pens with just LED. I'm talking about technology here, so I'm not going to tell you what pen manufacturer to buy. I would say that do your research, ask for a demo, ask for the benefits, is there support, and of course, are the needles disposable, and also is it easy to restock the needles, etc., etc. And like I said, this is also talking about your aesthetic practice and your scope of practice. You have to check with your State Board of Cosmetology if they allow microneedling under your scope of practice. Then you also have to check with your liability insurance if you're covered for microneedling. Now there are two different types of liability insurance. I know Associated Skincare Professionals does have an advanced esthetician liability insurance, so that may be good for a single practitioner. And then also you can get medical liability insurance from your insurance carrier, like Marine, Hanover, some of those. They will require a medical director. And then again, it depends on your state and your licensing, and the medical board, does that medical director have to be on site or not? So there you go. There's sort of the gray areas. I'm not telling you you can practice microneedling. I'm just saying you need to check with your state licensing boards, because every state is going to be different. So I do microneedling in not at my school, but I do it in my spa, and I have my advanced esthetician practitioner liability insurance, and then also I have medical liability insurance for the spa with a medical director. And so those are kind of what we're doing in Georgia. So what you're doing in your country, what you're doing in your state is going to be very different. Okay, so what can microneedling address? Wrinkles, scarring, acne, the appearance of enlarged pores, thinning hair or hair loss, and this has got to do with your protein-rich plasma in the blood that's going to stimulate hair growth. Thinning hair, hair loss, skin pigmentation issues, stretch marks, loose skin such as weight loss or after liposuction. You know, the risks are very low with microneedling, and that's why I love it. You'll see a little bit of edema, a little bit of swelling, a discomfort at the site, redness, bruising, dryness, flaking of the skin. I would say with the bruising, that's why we're going to do different needle length in different areas. Obviously, the forehead is a lot thinner than the cheeks, so you're not going to go as deep. Bleeding is uncommon. It's just that pinprick petechia bleeding you will see, but not a lot of bleeding. So the bleeding will probably occur with a deeper needle, but remember, you don't have to reach bleeding, pinprick bleeding to achieve results. You're still triggering that collagen. So that's something that I want you to remember. If you don't see like blood everywhere, that you know, with all the little pinpricks, that doesn't mean it's not working. Okay, so it's all got to do with comfort level, how many times we've had microneedling, numbness of the skin, thickness of the skin. We are really looking for our endpoint, which is our erythema. Lovely erythema, which is the pinkness on the skin that you see to trigger the collagen. So bleeding may also be more risk with people who have bleeding disorders. So we're not going to be doing microneedling on people that are on blood thinner medication. So it's very important for your intake form for your clients to be disclosing this information. And then you're also deciding, do you need a doctor's note, or are they not a candidate for the service today? Don't be afraid to turn down a client or have, want to have further investigation or some sort of note from the doctor. And if, your clients say, well, I'm going to go elsewhere because a spa B, they always do the service on me, then, perhaps spa B is where she needs to be. You also have clients that say, oh, I go to the dermatologist and they set the needles on 3. And say, well, then perhaps you need to go back there because I'm an esthetician and I don't go further than the epidermis. So, so we just want to be very careful of infections because the skin is open, right? So we know that the skin is the first defense for the environment. So I try and tell the clients not to touch their face, not to put anything on their face for 24 hours, not to work out. We don't want any bacteria, pollution, any environmental factors going into that skin and causing distress. Okay, so and other problems. So that's important. Post-care is very vital. I always recommend a post-care form to give to your clients, to read to your clients as well. So something that I do is I apply numbing. Again, your clients, they must not be allergic to lidocaine. And there are different types of numbing out there and different companies. So again, I'm not going to tell you which one to buy. And of course, numbing has been used with tattoo artist for years. So, but there is lidocaine, and there's some people that can be lidocaine sensitive. And remember, if you are, 0.25, they're probably not going to feel it. You probably don't need numbing. But numbing has to stay on the skin for like 30 to 45 minutes. So there is a lot of time. There's your time there with the client. So what do I do during that time? I massage their décolleté so that we can start breathing and we can start relaxation. I talk to them about the pre and post care and what to do after the service and explain the service to them. So I have time with my client to go over those things. So do allow 30 minutes if you are going to numb into your service time so that you can, know when to book your next client. So we're still looking at about 45 minutes to an hour. All right, so contraindications, skin infections, scleroderma being a skin condition that you need to be aware of is a contraindication. Active acne, we do not want to be breaking up acne pustules and spreading bacteria on the skin and creating wounds on the skin. Keloid scarring, people that hypertrophic scar or keloid scar, this is not a service for them. Eczema, anytime there are lesions on the skin, broken skin, open lesions, this is a problem. We need full healing. Herpes simplex, we do not want to spread herpes, and so we have to wait for full healing. If there's somebody that, if there's somebody that tends to get a lot of breakouts, they need to disclose that, and they could take their herpes medication. We are not on the lips, but we do go around the lip area. Also, I don't go above the orbital rim, but I can teach you when I do microdermabrasion or other types of treatments, like let's say IPL and your hand piece is larger. I'm going to touch my face now, but I have sanitized my hands. So you're going to go ahead and touch and then you can pull down that skin so that you can get some of that skin around the orbital area. So that's a little tip when you're doing certain services and you can't go above the orbital rim. Blood clotting conditions, I talked about that. Bacterial or fungal infections, immunosuppression therapies. If you have an immune disorder, that is a contraindication, but a lot of times people will be on a therapy to suppress their immune system. So you want to have a conversation with them and they want to have a conversation with the doctor, because that's going to have to be stopped, whether it's 12 hours before, a day before. I don't know. Again, I'm not a medical professional. That is something that needs to be discussed, okay? We don't like to do anything on people that are pregnant or planning to be, except for I like to do spa facials. And then once they finish breastfeeding, because we're also using serums and active ingredients to push product into the skin. Okay, so what is microneedling? Well, it's micro injuries or micro wounding of the skin. It is a remodeling of the skin using microneedles to penetrate at different depths, right? So we want to reach the dermis and stimulate the production of collagen and elastin and hyaluronic acid. And hyaluronic acid holds 1 times its weight in water in the skin, so it's really important for that really good moisture balance that we need. It's controlled wounding, controlled micro injuries, which stimulates the healing response of the body. So we're dependent on our own healing response. That is why when you have autoimmune problems, we may not be able, your body may not be able to heal. And it's also nice to use LED afterwards, because that increases ATP in the cell, energy in the cell, to promote wound healing. So those two things work nicely together. So microneedling is a device that has tiny little needles, and they are basically pushed in and out of the skin, and then the body repairs these tiny punctures to produce new collagen. And remember, remember the hands, fabulous for the hands, for the neck, and for the décolleté, really anywhere in the body. But you really can use, you really can do it all over the body. I would recommend changing up the needles. That's why it's a cost per area, because you really want nice new needles for your new areas. And you're also going to want to cleanse and decrease every area that you're working on, all right? I don't like to rinse off any of blood that's left on the face, because that's power-packed, full of growth factors to help stimulate collagen, okay? So usually, you know, and of course there's the vampire facials, the PRP therapies, and that's something that I'm not talking about today. But when you are skin needling and microneedling and you have some of that pinprick bleeding, leave that on the skin. All right. All right, so our wounding and repair, we have 3 phases. When we're wounding, you're going to see inflammation. You're going to see your end point of your erythema. And so the microneedling is going to trigger the immune response, right? So we want the immune system to heal itself. The increased blood flow assists in the creation of new tissue, and that's what we're looking. And then our proliferation stage, what's accelerated there is the wound is rebuilt within the granular cells to create a new network of blood vessels to feed the skin. And then, of course, we are remodeling the wounded area, and it is replaced with new dermal tissue. So there we have our 3 phases of what's happening underneath the skin. And it is a huge network. It's not happening all at once. We are starting these 3 phases, and that's why they're going to see an immediate effect of the skin looking fabulous, but it's definitely going to improve and get better over the next couple of weeks. So what is a fibroblast? So this is it is an active cell of connective tissue, right? They are large and flat, and they are spider-like, and the cells are processing, extending out from the ends of the cell body. The cell nucleus is flat and oval, and fibroblasts produce tripocollagen, which is the forerunner of collagen, and ground substance, right, which is a gel-like matrix that fills spaces between cells and fibers in the connective tissue. So when we are collagen remodeling, you're going to see the skin's going to start improving up, and production is going to be forming 14 to 15 days, and then it continues through day 20 to 21, and then collagen peaks after 6 months. So we like the client, if they're on a series, which I like at least a series of 3, so they come back every 6 to 12 weeks for so sell it in a series because they're going to see the best results, and also do a before and after picture every time and have them sign that they're allowed to have a before and after picture. And then you can also get them to check if you can use them as a case study. Use them as a case study for your marketing and branding. I suggest black out the eyes, don't have their name. But if your client doesn't want their face to be used, that's fine. But let them know that we are taking these before and after pictures so that you can see the skin improvement over time, so that you can show them in the beginning of the series, during the series, and at the end of the series, how their skin has got so much better, right? The evenness of the skin and the plumping of the skin and the building of the collagen. All right, so what is collagen? So collagen refers to a family of proteins that are primary structured component of connective tissue, such as skin and cartilage. All right, about 90% of collagen in the body is type 1, which is found in the skin. So we're definitely in the collagen business. We're definitely in, the plumping business, the volume business, like I say, right? The collagen business. All right, so there are 16 different types of collagen, but we are definitely working with types 1, 2, and 3. So type 1 is strong in the hair, skin, and nails. Type 3 is used for the same. And type 2 is collagen prevalent all over the body, right? So also we look at, again, ingredients, and we look at anti-inflammatory and collagen building and immune building ingredients, are antioxidants. And also always talk about the foods that we eat, and the ingredients that we put on the skin is vital for collagen in our body, for promoting promoting health and well-being. Okay, so I'm looking at those active ingredients in our skin. I'm also using a serum that has a slip and a glide when I'm doing the microneedling, so that makes it easier to penetrate the serum. We use a hyaluronic acid serum, so I use that when I am doing my microneedling, and I'm also telling the client to go home with the hyaluronic acid serum to use post-procedure. Okay, so depth recommendations. I also like the client to be using an aesthetic roller that doesn't penetrate the skin, it just stays on the epidermis. in between that'll help products penetrate, trigger the skin, carry on the healing process. So that would be a home roller, which is about 0.2 millimeters to 0.3 millimeters, and that's designed to not penetrate or not to cause pain. So no topical arsenic is needed. So when you look at this reference chart, which is from Skin Pen, this is just a rough guide of your needle depths, which will help you. The forehead is, like I said, thinner, so you're going to start at your 0.25, and then you're going to your eyebrow 0.25 to 0.5, your nose area 0.25. We want to work on the enlarged pores, right? The eye area 0.25, the cheekbone area again 0.25 to 0.5, because the cheekbones can be thinner. And then of course the cheek area is going to be where you have the most volume. So that's where you can go to your 0.5 to 1.0. Upper lip 0.25, we know how sensitive that is. Facial scarring and stretch marks, surgical scars, that's when you're going to need a deeper needle. How you do this, if all of you are trained in microdermabrasion and that crosshatch, that is what I'm doing. I'm doing going up, I'm going out. You can see even I'm going up, I'm going out, going up, and then I'm going to also do circular movements, and I'm going to be waiting. What I'm looking for is a nice erythema, and then I'm going to move to the next section. So just like chemical peels and microdermabrasion, I'm dividing the face into quadrants, and I'm doing my one way or the other. I'm going to find you, I'm going to get you, and then I'm going to do circles, but I'm looking for erythema, and then I move to the next section. You may or may not have pinprick bleeding. Okay, so don't think, oh my goodness, I've got to carry on until I see that. No, your endpoint is your erythema. All right, microneedling on active acne could spread the acne, could cause infection, mild rosacea, hyperpigmentation, it's great, but with melasma, it could make it worse. It could make it better. So, but I would be very cautious with rosacea and with melasma. If it's partial rosacea, I have rosacea, but I call it partial because it's really on my cheeks area and it's mild. So I'm going to do a lighter microneedling on my skin. Side effects, not many. Pink, redness, right, may probably subside within 24 hours. I like the client not to wear anything for 24 hours. I'm not even sunscreen. I don't want sunscreen to go into those holes in the skin. If they're going to go into the sun, of course, they're going to have to wear chem-free sunscreen, but it'd be great if you could do it at the end of the day, and if they could go straight home, no sun for 24 hours, 48 hours. There may be some redness, stinging, itching, tightness, and some slight peeling from speeding up of the dead skin cells from the trauma. So visible results of skin rejuvenations are seen just after 6 to 8 weeks. So they're going to see something immediately, but they've got to be patient because they're going to see over the next 6 to 8 weeks how beautiful and even and minimize the fine lines and wrinkles are. And then we're going to go ahead and do another one, all right? So it'll continue for the following months up to a year. A course of 3 skin needling sessions are recommended to achieve optimal results. Clients also encouraged to use their home roller in between, and this is a home use roller that they can use weekly, daily, before they put their serums on. So I like to talk about pre-care and post-care. This is important information for your clients to have, and you can put this on your website. You can explain to them over the phone when they book the service. They should avoid sun exposure for 24 hours prior to treatment, and they should discontinue their retinoids 12 hours prior to treatment. You should not have an active breakout, active cold sores, or open lesions. If this occurs, your microneedling treatment should be rescheduled or stop. Wait 6 months following isotretinoin Accutane use. I think I would also do a disclaimer. If you're working for a doctor or you're in a medical practice, your doctor may have different protocols and different procedures pre and post care. So I try and take like sort of universal ones that are going to be, I'm going to err on the of caution. I'm going to make sure that I tell them absolutely what they should and shouldn't do pre and post care. And the doctors may have a different protocol to get a deeper microneedling, etc. Okay. Wait at least 48 hours before or after Botox to have a microneedling treatment. Wait 1 week before or after any fillers, such as Juvederm, Restylane. 1 month before or after any treatment, such as IPL, V-beam, etc., or chemical peels and or microdermabrasion. All right. You definitely want to. You can include the post care in the package, or you could say this is what you need to be using. So in my skincare line, we have products that have a lot of very desensitizing, counter-irritant ingredients, and we don't use fragrances or a lot of essential oils except for ones that are known to have those counter-irritant, reduce inflammation type of ingredients. So I use our HA serum during the procedure, and then of course they go home with it to really, because sometimes the skin can feel really tight and dry. So this helps keep the skin feel moist and pliable. They can then, of course, after 24 hours, they can go on to the other products. I like to send them with a gel type cleanser. Our Daily Gentle Cleanser is brilliant for pre and post care. And then of course the Power Rescue, which I like to say is a non-steroidal moisturizer, which has very powerful anti-inflammatory botanicals. So that's another one. I use Power Rescue every day because I have reds on my skin. So the HA serum, the Power Rescue, and of course a chem-free SPF. We only use chem-free sunblock in our line because any chemicals are skin irritants, and I don't like to use skin irritants on the skin, so that's important. All right, so just again, only use anti-inflammatory type ingredients and serums that can hydrate the tissue, that are non-irritating for the next 24 hours. Day 2 through day 4, we're going to be using a 1, 2, 3, our Daily Gentle Cleanser, our chem-free sunblock, our Power Rescue, and our HA. And then of course, avoid exercise for 3 days. We don't want sweat to irritate the tissue, and no sun exposure for 3 days. Okay, so the treatment protocol, we definitely wear gloves, all right? So that's a no-brainer. I used to say that, you know, for the cleansing routine, I don't wear gloves, the skin analysis, and then after skin analysis, I'm gonna wear gloves. But now through COVID-19, we're gonna be looking at all of our PPE protocols, all of our sanitation and safety. I'm gonna say wear gloves and a mask from the beginning of the facial to the end of the facial. That's gonna be my recommendations for the esthetician. So we're gonna cleanse and degrease the skin. I like to use a foaming cleanser to degrease and defat the skin. And that of course would be my Daily Gentle Cleanser, but whatever cleanser you're using. And then of course a degreasing agent, alcohol, witch hazel. We have in our line, we do have a degreasing agent with tyrosinase inhibitors. If you're going to use numbing, you're going to have to leave that on for 30 to 45 minutes. So therefore you have time to massage the décolleté, to go through pre and post care, to thoroughly make sure and talk to them about any new medical conditions that maybe they hadn't have discussed, and what they're going to be doing on their skin, post care for 2 to 3 days post the treatment. Take your before and after pictures. You're going to wipe off the numbing agent if you've used it, and then you're going to apply serum to the area that you're working on, because let's say you apply a hyaluronic acid serum, which has a nice slip in it to glide the pen, it may dry up on other areas of the face. So think about dividing the face into your face into quadrants, all right? and then go ahead and apply the area that you're working on, glide, apply to the next area. And so that's for me to just stop for the SMA area. I wipe down all of my cart and even my bottles with my barbicide, cavicide, and whatever wipes that you have that can really destroy viruses and bacteria. So I wipe my cart down as well as my bottles. But I think as estheticians, sometimes we forget that we're reaching for those bottles and that we're pumping into the hand and we're putting the bottle back. And even though we have our gloves on, we're touching. So I want you to really think, I want you to look around your room, and I want you, it's time to really declutter your treatment room and really only have things in there, like no ornaments or things, but just things that you need. What do you and your client touch? Do you have a cabinet? Are you opening that cabinet? What do you need to wipe down? And obviously we are disposing of the needles in a biohazard container, right? So that's important. Don't throw those needles into the trash. And most brands of microneedling will have a sleeve that you're going to wipe down your microneedling pen, and then you're going to put a sleeve on it, and then of course wipe it down when you're finished as well. I also like to open the microneedle needle in front of my client. I show her that I'm opening the packet, and then I put it on the pen. So I don't put the microneedling needles on the pen when the client isn't there, because I want her to know that it's a brand new needle, that I've opened it up so she can see. I think that builds a lot of confidence in the client. And I do that with dermaplaning as well. So I like them to know that it's brand new, that it's sterile, it's in a sealed, sterile container, it's one use. So that I think that's important. And then I perform the microneedling, and I apply some serum afterwards again, because of course I have the pinpricks that's open, so I apply the serum, and then I go through my post-care. Going through the post-care again allows me to kind of watch the tissue response on the client and make sure she's good to go home, and also explain not to touch the face, etc. All right, so products that are used during the procedure, serums that are made specifically for microneedling, that do not have any skin irritants in it, like perfumes or dyes or fragrances that'll irritate the skin. We don't want to drive those things into the skin. So there are a lot of serums with antioxidants as well, and immune boosting ingredients are great. There are some stem cell serums out there that can be used as well. And of course the serum will not only be penetrated, but will also help the pen glide over the skin, and there's better penetration of the product during the service. Microneedling can be combined with peels, very mild peels. I would not do that first though. I would see how the client reacts to microneedling. And then of course you could add LED. Another thing that I've seen, which seems to be quite nice, is applying a sheet mask and then maybe an ice globe massage, which will really cool the skin. And then of course, proper skin analysis and consultation. And of course, you're always going to follow manufacturer guidelines of what that pen company advised, of what you can combine this pen with and what you can't, and the depth of the needle when combining these modalities. And always proper skin analysis and skin consultation. Again, I think you really want to follow your state board regulations. I definitely think only licensed practitioners should be doing this device, should be using this device on clients. I think that you need to check with your state board and of course your medical board. And every state is different, every country is different. Look at your liability insurance. Does it cover it? If it doesn't, get more liability insurance. Talk to your associations. Find out what liability insurances are covering this. And then, do you need a medical director to do these procedures? This, again, my webinar is purely educational. I hope that, there are some takeaways or at least I'm reaffirming what you are doing in your treatment room is correct, and to have as much information on your websites and your blogs to explain the benefits. I've seen pricing of microneedling from anywhere from $195 to $495 in our area. So again, have a look at microneedling. I don't like to discount services like this. I do not do Groupons for services like this. It's just me personally, because this has to be done safely. This has to be done by a licensed professional. This has to be done in a way that we have clients that are understand that there's always a risk that are involved with these services. But again, the benefits outweigh the risks. But I cannot control what happens when they go home, and I cannot control if they do have a reaction, right? I'm going to do to the best of my training and my knowledge and what I call my living laboratory, because when you're working on skin and tissue, you're seeing a lot of tissue response where you work. And so you are dialing the depths of the needle to what you know and what you see on the skin and what you've seen working on multiple clients. So therefore, I do not like when I see discounts of, you could give them a special for their first time, would be my advice, if you'd like some interesting marketing tools, to say 20%, or you give them a value added of products in the series, because a series is usually buy 4 get 1 free, buy 4 get 1 free, and then of course you can include a value added product or discount of product when they purchase the series. But they're coming to me for my expertise, for my years and years and years of expertise. So if they can get a Groupon at another, or a deal at another place, and that's what they want to do, then that's great. I just stand by my education, my training, and my expertise, and what the client is getting. And you may want to say, well, I'm going to, as a value added, I'm going to add LED in to every service. So that's another way you could market it, by adding value. So just a little bit about me. I own a school. I've had my school for 12 years. I have an esthetician nail care program and massage care program. I have my own skincare line. I am an esthetician in my spa. I own a spa called Esthétique, the art and science of beauty. It is a beauty experience. So I utilize all of my knowledge to help you guys, to help you with education, consulting, formulations, whatever I can do to support the industry, because I feel that there's enough people out there that really aren't industry professionals, doing what we do. And I know how much money and time you've spent on your education, on your continuing education, on your licenses, and on your businesses. So anything that I can do to help you make more money, this time will be over. You will have a time. We will be going back very shortly, May, probably June, to be looking at different ways that you can make your clients comfortable. Remember, we only see one client at a time. Well, I can only work on one face at a time. I don't know about you guys. But I'm definitely going to be wearing gloves throughout the whole facial, a mask throughout the whole facial. I definitely will be sanitizing my room between clients, right? Definitely be thinking about what is the client touching and what are we going to be doing away with. Let's think about things about what are we going to do about, we love the cozy blanket, but unless you're washing them between each client, so maybe we're going to have 6 blankets and wash them after each client, or use a disposable sheet or something with a heating pad. So we're going to be really looking at different ways to make the client comfortable in this new normal. But remember, we've been doing this for thousands of years with really incredible results in safety. And that's why we have a license, because we bring all of our SMA practices into fray. Just think about how many times we touch our glasses, etc. So I want you to be writing down a list of things that you can do to make the area safe and make your clients safe, and then have that information readily available for your clients, that you really are going to be looking after them and keeping on top of their skin goals. So thank you for this. We're going to go ahead and bring Josh back on.
I'm here. Hey, everybody.
I hope you enjoyed that, Josh. You're going to be the most brilliant esthetician after all of these.
I mean, I tell you what, I'm not a licensed esthetician, but I feel like I'm getting there at this point. So,
or you're going to be sick of my voice, one of the two.
Well, I hear you all the time. So we're going to go into the Q&A section. We're not done yet, so don't leave. Everybody's saying thank you. We appreciate your thank yous, but don't go anywhere. We're not done yet. So basically, real quick before I go into Q&A, I want to share with everyone that I've had microneedling done myself on my skin, I think about 8 times now. And I've seen pretty amazing results, and Elaine can attest to this. She's kind of seen my skin transform over the past couple of years throughout my treatments. So I will recommend it for those who are looking for, you know, fine lines and wrinkles and acne scarring and just skin improvement in general. As someone who comes from the client point of view, Elaine comes from an esthetician point of view, I come from client point of view, and I love it, and I can't wait to get it done again. So I think my skin looks pretty good. All right, so.
And then, of course, dermaplaning in between, because if it does stimulate hair growth, that's a great, that's a great thing to promote to your clients once it's healed, you know, in the 6 to 8 weeks, maybe a dermaplaning may be needed.
Fair enough. All right, so going to the Q&A, we have Jamie asked, can you do LED in the same treatment right after?
Yes, remember I talked about that. I think it's a great value added, you know, to throw that in, because obviously blue LED, there's so many different colors, but blue is going to really deal with bacteria, and red with building collagen as well as reducing redness in the tissue. So if you're doing acne, use the blue and red. If you're dealing with somebody that's fine lines and wrinkles, then do the red LED, a light emitting diodes. Like I said, increases ATP in the cell to help heal, right? We need the skin to heal itself, and that's really going to help heal the tissue. So I would say that's a great thing to add in anyway, because you know 5 minutes at the end, you're going through post-care, you've got some time to add some LED.
All right, and then we've got Jacqueline. She asks, is Juvederm a contraindication?
Yes, remember I said the one slide, you want to wait at least a week to 2 weeks after fillers.
And Jocelyn asks, can you microneedle the center of the throat?
Yes, I mean, I think she's mentioning, I don't know what she's thinking, but I think she's thinking LED or light therapy. We're usually concerned about, because of increased of ATP, we're concerned about thyroid conditions in the aesthetic world, but we're not LEDing. Is that what she's saying, the center of the neck area, the throat?
Yeah, I think she should. All her question says is that she wants to ask about the microneedling center of the throat. And
yeah. Now, remember with microdermabrasion, you hold the skin taut. I would recommend you do that too, because a lot of people have loose skin. And then when I microdermabrasion or microneedle, you can ask the client to raise their neck a little bit, so you've got a nice flat edge. And remember, the neck is an add-on, right? So you're going to do the face first and then the neck, or the neck first and then the face. So that's an add-on, and I would recommend using a new needle, and you're going to charge for the neck. And so when you've raised the neck, you've got a nice flat area when the client just lifts their chin a little bit.
Lisa
asks, sorry, and then, you know, when you're doing the face, you may also need to hold the skin taut.
Lisa asks, what do you use as a degreaser for microneedling?
You could use alcohol. We have a professional degreaser that contains tyrosinase inhibitors, so you can use a professional degreaser as well, but alcohol is fine. Just remember when I degrease the skin, I usually go from the top down, because if you go from the chin up, the aroma goes up the nose. Sometimes it's not pleasant for the client. The other thing that I guess tip is that the table, I raise the head a little bit, so that that's a little bit more comfortable for the client for aromas, as well as if they get nervous or panic during the service.
Rachel asks, if the client experiences mild discomfort once the numbing product wears off, could we recommend taking Tylenol?
Yeah, but I don't think it's necessary, because that's going to go away. I mean, that, you know, the discomfort is during the service and when you're on that area. You know, yeah, it's not going to be afterwards. And also, I'm never going to tell a client to take a Tylenol or a Benadryl. If that's prescribing. If I say, oh, take a Benadryl, take a Tylenol, that, as far as I'm concerned, as an esthetician, that's a no-no. Because even if it's over the counter, I can't prescribe. But you know from yourself, the discomfort is just while they're on the area, right?
Right. I was going to jump in and say, as someone who's had it done on my face many times, I don't ever remember experiencing discomfort after the procedure. It's only been during, and it's usually very mild because the numbing cream is usually pretty strong that's been used on me. And they wait 20 to 30 minutes before they do any of the actual microneedling. So to your point, I think that they shouldn't experience any discomfort afterwards. And I think, in my opinion, if they do, there's an allergic reaction, something's maybe gone wrong, is where I would look at that. All right, let's see. How much time do you have to, Karen asks, how much time between procedures?
Remember we said that 6 to 8 weeks because we need that full collagen development, and also there's so much happening underneath that world of building that collagen and elastin, and bringing nutrients into the area and removing waste and all of that. So that's why we need 6 to 8 weeks between each one.
Let's see here. Got a couple of repeats. I'm just making sure I don't ask the same question you've already answered. Keloids, we know, are not a candidate.
No.
They say if you want to add, Jenny, I think it is, asks if you want to add radio frequency to microneedling, could you do that pre or post?
Well, there's the Vivace machine that combines microneedling with, remember this is an intro to microneedling first of all, right? So, we could have other classes on microneedling for acne scars but the thing about the radio frequency, I could say that you'd have to go to the manufacturer and ask them not only when they recommend you do it, but or the manufacturer of the radio frequency, what heat setting are we using? Because we are already causing heat and edema in the tissue with the microneedling. So what settings are they recommending for the microneedling? So that's something I would go to your radio. If you're going to do it separately, I would go with because the Vivace does it, the microneedling machines with the radio frequency do it at the same time.
So Megan asked, and I think you may have mentioned this, but you talked about 24 hours after you don't recommend them putting anything on their face. But she also asked, so to avoid water.
Except for the serum, because it may feel dry.
So what about water? I think she says, do they not put water on their face? Are we avoiding water as well?
For 24 hours?
Yes.
Yes.
Okay. I think I know the answer to this one, but I'm going to ask it anyways, because a lot of people have asked about combining therapies. And Christina asked about, do you use with a chemical peel? And I know the answer, but you can.
Sorry, do you use what?
Can you do microneedling with a chemical peel?
Yeah, a mild one.
Okay.
Explain your experience. Did you have it with peels?
I did not have it with peel, no. I was going to say, I think anything super strong is going to be something you're going to avoid, especially considering how much
absolutely not deep. And I think that you should start them on I think you should start them on just microneedling personally. I don't combine them, but I just give you the training and the information. I just do microneedling on its own. I like to combine dermaplaning and microneedling. Dermaplaning and chemical peels.
Anonymous has a good one. I don't know if you touched on this one. Do we wash the numbing agent off or just wipe?
I just wipe it off.
Okay. And the further question is there not a chance of the residual being pushed into the skin if it's only wiped away? That's a good one.
There's not a chance that it's in the skin already. But like I said, you really don't need a lot of unless you're see your client's comfort. You could you could wet the acidic wipe it off, but then you got to make sure that you dry the skin as well. But I'm just thinking that there's a certain amount that go into the skin anyway. That's really the idea.
Yeah, I mean, considering how long it sits on the skin, it's definitely going to be absorbed.
It's already in. Yeah.
So thank you again, everyone. Elaine, I'll let you close it out.
Be safe. I pray for all of you. I hope to see all of you. I know that we're going to come back better and stronger than before with all the knowledge that we've gained. And I look forward to seeing all of you again and to meeting all of you somehow, some way, because we are a community. We're a spa community. So I love you, and I'll speak to you soon. Bye.
Bye, everybody. Thanks, Elaine.